overdose in the Fraser Valley. So I have some stats for you so you can appreciate how important and relevant this issue is in our community. So since 2000, illicit drug toxicity deaths in the province hover between 200 and 400 per year. And then in 2016, we saw a jump to almost 1,000. And then in 2017 and 2018, we saw that jump again to 1,500. And we're seeing about the same similar loss of life this year. And so often when we think of addiction, we think of downtown, Lower East Side, homelessness, as that's a big part of the media narrative. But in fact, according to the coroner's report, and so this is the report that came out in July, the report for July in August hasn't come out yet. The highest number of illicit drug toxicity is actually here in the Fraser Valley, with 228 deaths year to date versus, as a comparator, Vancouver Coastal at 180. So super important issue. I'm really glad that you guys have joined us tonight. Around the same time I met Daniel, I had an opportunity to visit Wagner Hills Farm. And so as I continue to learn about this issue, my belief is that we need to prioritize treatment and a continuum of care alongside harm reduction so that people have a direct line to reclaiming their lives. So the cool thing about a campaign is it's really an excuse to have a conversation and a discussion. So, while I don't necessarily agree on everything that Daniel might share tonight, I think he has a very unique and extremely valuable perspective. So the goal for tonight is to really provide a baseline of understanding and a bit of a common vocabulary so that we can face this crisis as a community with wisdom and compassion. And so we're going to do it interview style. I'll ask Daniel, 7 to 8 questions, and then I'll be intentional about leaving time at the end to do open Q&A. And so you can do that through a number of mediums. You can use the chat within the Zoom function, or, those of you who are joining us on Facebook Live can ask through there. And, we have a moderator who's checking that form as well. Okay, so, I also wanted to share with you guys, most of you who know me know I'm a big believer of respectful debate and discourse. And so, if you have an alternative perspective or you have personal experience with this issue and you think that there's something that, we haven't shared that should be shared, by all means, put that, in the Q&A so that we can get to that. So thank you for joining us. Let's jump right in. Daniel, are you ready?
Hi, Miranda. Yes, thanks.
Okay. Question number 1. So let's begin at the beginning. Can you share your story and struggle with addiction?
Yeah, well, I don't know if I can in a short answer, right? But it's a complicated story, and I think the whole topic that we're discussing is very complex, and there's a lot of nuance to it, which is why it's really encouraging for me that you are engaging with this issue. I spent 15 years addicted to opiates. Heroin was my primary drug of choice. It started in my late teen years with alcohol and cannabis, as it does for many people who develop problematic substance use. And my up and down kind of back and forth journey with addiction involved a lot of detoxes, various treatment centers, and a real tug of war with family and friends. As you can quite imagine, it wasn't the prettiest at times, but an important element of my story, and one that I think is very relevant for the conversation that we're having tonight, is that I wasn't a person who ever did become homeless. I actually had maintained employment and housing vehicle all through my years in addiction. Even at the darkest points, I was somehow managing to hold it together on the outside when I was completely imploding on the inside, and people were wondering if I was going to even live another day. That I maintained this outward appearance of trying to be like I had it all together. And I'm very grateful to be able to have this conversation with you, because honestly, in light of the current overdose crisis and the presence of fentanyl in the toxic drug supply that is on the streets of British Columbia, I probably would not be alive had I been using drugs during this time. And so it's important that we are getting the message out about the drug supply and about what is driving the overdose crisis. I also want to communicate a message of hope in my story, and to anyone that's listening. Addiction is not a life sentence. The popular mantra, once an addict, always an addict, is not true. And I would defy anyone that claims it is. People change all the time. And in fact, most substance use, including problematic substance use, is something that people manage to overcome and grow out of, the vast majority. But like you alluded to in your intro, the media narrative would tell us otherwise. It would tell us that that drugs are bad. Essentially, people that take drugs become addicted to drugs. When you become addicted to drugs, you become homeless. Your life falls completely apart, and you are at risk of overdose, or you do overdose and die. End of story. That's kind of the oversimplified perception that many people have about addiction and about what's going on in our province right now. So I'm hoping that, by sharing my story and answering some of your questions this evening, that we can really just change the narrative and change people's perspectives and attitudes around substance use. Obviously, I did not die, and I'm here to share my story. And I have overcome addiction. It's no longer, I don't even call myself in recovery anymore. I've simply moved beyond that. I've moved on. I don't feel a draw or anything to that. And that's a complicated part of conversation. And when we get into the recovery piece, and it's very nuanced, and each person's story in that respect is going to be unique to that individual. So I don't want to be saying this is how all stories are in terms of the overcoming of addiction, but it's the story I'm sharing is my own. So yeah, 15 years opioids and heroin, and now married with two kids. Actually, a large portion of my addiction took place even in the early years and during my marriage and when my children were young. And my wife is someone who was very instrumental in me overcoming my addiction and being someone who loved me despite the darkness that was around me, and her unrelenting willingness to not give up on me is one reason I'm here today. And that is an important part of how we need to address addiction in our societies, is with compassion and love and hope for the individuals, and not by cutting them off or writing them off or just removing them from our lives. So
thanks. Yeah. And so 15 years of addiction and, being somebody who's overcome that, can you give us a few more specifics around, okay, so your wife played a really critical role in, helping you to not give up hope. And then what were some of the tangibles, like in terms of recovery and center and, cold turkey? What were the strategies that you used to live the life that you're now living?
Best answer I can give to that really is to just say, like it is for anybody, addiction or not, life is a process. It's a journey. And if we support people in the middle of their process, then the odds of them finding success or beginning to move into their potential increases. But if we disconnect from people and cut them off in the middle of that and demand things of them and say, this is the way it needs to be, and abstinence is the only way, and you need to go here and you need to go here tomorrow or else, like that approach, while it was tried with me by, every approach was tried with me over the years, the most helpful stuff was the people that were meeting me where I was at. And so I think we could get into a conversation about harm reduction and about the treatment, and how those two seem so kind of disconnected from one another for some reason, as though those who advocate for harm reduction are opposed to treatment. Like that's kind of the perception we sometimes get, or the idea that people who say, we just need to get everyone into treatment and we need to get everybody sober, they're often viewed as being opposed to harm reduction. And somehow I want to be a person who bridges that gap. There was times in my life that I needed people to meet me where I was at and keep me safe in that space. Like if that involved harm reduction measures or considering other alternatives to just being completely abstinent, that should be on the table for people. And there were other times in my life where I needed people to pull me a little harder towards a better life. And their desire for me to attend treatment and whatnot was very valuable, and it did make a difference in my life. One thing we know for sure, data backs this up, coerced treatment is an absolute failure. So forcing people into treatment does nothing in terms of benefiting the individual or the family or building a stronger connection. It actually creates more harm in the end. So I'm opposed to any kind of policies that would move us towards coercing people that identify as having a substance use disorder, coercing them into some kind of treatment. That's just not going to be a helpful move.
Okay, and we can get into that a little bit more when we talk about solutions. So some more stats here. So in BC, there have been, between March and June, 174 COVID deaths. I believe it's about, 198 to date. And during the same period, March and June in BC, there were 577 illicit drug toxicity deaths. And June represented 130% year-over-year increase, with the highest number of illicit drug toxicity deaths ever recorded in 1 month in British Columbia.
Yeah.
Can you help us understand why overdose is on the rise?
Yeah, and while the July numbers have not yet been released, they should be out any day. I think most people are anticipating they might even be the highest yet. So it's really devastating to see these kinds of numbers. And why are they increasing during the time of COVID or over the last few months? Why are they increasing? I think mostly it's anecdotal, the evidence that we have to explain this. There's a few key factors. The drug supply has changed. So going back all the way to 2016 when the overdose crisis was declared a public health emergency in the province, that was because of the increase of the synthetic opioid fentanyl in the drug supply. And fentanyl has not left the drug supply. In reality is it's here to stay. It's a highly profitable opioid. It's replaced heroin. It's cross-contaminated stimulant drugs, so drugs like cocaine and MDMA and methamphetamine. These drugs have all been found with fentanyl in them at some point along the way, and that's one reason overdose deaths have increased so dramatically. Now, during COVID, we also have border closures, and the traditional routes of moving illegal drugs into the country have become maybe a little more difficult. Drug suppliers are stretching their drugs further, so they're more contaminated than ever before. People are further disconnected. I mean, for 4 years, we have been messaging people not to use drugs alone, be with a buddy, make sure someone's with you. And then all of a sudden in March, we're telling people to isolate and stay away from people. And so those that were making some effort to be safer with their drug use, or maybe were always with a buddy, may have been separated from that. There's perhaps other factors. There's a highly contested debate about whether CERB has played a role in increasing overdose deaths. And I think that can add to the stigma of people who use substances. The perception would be, if we give them money, this free money, then they just use more drugs, and that would be why they're overdosing. And I think that's a little bit reductive way of considering what is happening here with CERB, because we do know that providing people with cash when they're marginalized and their life circumstances are difficult, or perhaps they're homeless, can be a hand up, and it can be helpful. But we also know, people that do struggle deeply with addiction, and in this difficult time of emotional distress and social distancing, substance use is definitely up, and more people are using drugs than have been maybe in the months prior. So complicated, but the fentanyl is not leaving our drug supply. It's far too profitable. And so we need to get that messaging out. We need people that are using substances to understand that it's present, and to make choices to be safer, to get their drugs tested, to have access to naloxone kits to use, or there's a cool app that came out, Lifeguard app, that allows people to connect virtually to someone that will check in with them if they don't respond, then paramedics would be alerted. So there's kind of a lot of measures to respond to the crisis, but these are gap fillers. They're not addressing the root issue, which is the toxic drug supply, and something that, from a political perspective, is something that does need to be discussed and is not really being discussed a whole lot by senior politicians in our country. And there are ideas on the table that could be talked about if we were really interested in dealing with fentanyl.
Right. So can you help us, just for people who maybe don't know, can you explain what a naloxone kit is?
A naloxone kit is a medication that reverses an opioid overdose. So I have one right here, actually. And they're free and they're available all over the place. So if you or someone you know is using substances, my strongest advice and hope is that you would get them a naloxone kit and that you would learn to use it. And I'm here in Langley. If you don't have one and you would like one, I'm willing to be someone who would personally deliver it to you and train you to use it if you would like to learn. But if you do go to your local pharmacy and ask for one, they will provide you one for free.
Okay.
So, yeah. Thanks.
And then just kind of before we go on to the next question, something that I've heard people ask is why is fentanyl so why is fentanyl so profitable? And aren't suppliers, this is going to sound so terrible, but I couldn't think of a better way to phrase it. Aren't suppliers concerned about killing their customers?
That's a totally relevant question, and you're not the first person to ask that. It makes complete sense. So first of all, let's just compare heroin and fentanyl in terms of profit. Heroin requires acres and acres of poppy fields to produce. They have to grow in certain climates. Then they need to be cultivated and converted into heroin, which requires chemistry and complex procedures to smuggle that drug into the country. A kilogram of heroin will net suppliers about $50,000 or $60,000. Fentanyl is a synthetic opioid, very similar, same class of drugs, much more powerful than heroin, but doesn't require poppy fields, obviously. Being a synthetic, can be produced in a lab by one person. And because of its potency factor, it actually takes up a lot less space in terms of smuggling, right? You know, when we're talking about 40 to 50 times stronger than heroin, obviously you need 40 to 50 times less of it for the same effect. So we don't need, you're not bringing in tons of fentanyl, you're bringing in half kilos. You're bringing in small amounts, which are very easy to smuggle. And then the profits on a kilogram of fentanyl are in excess of $1 million. Wow. So they're not even comparable. And that, to answer your question, that essentially means it's so profitable, the cost of doing business is that some of your customers die. It's just, it's a profit that cannot be turned down by the people that are supplying it.
Okay. So, let's talk about root cause. So another stat that I think supports what we're hearing you say, in that there's not a stereotype here. And I really want people to hear this. 72% of overdoses in the Fraser Valley are happening in private residences. So that means the majority of people are not homeless.
Right.
And, they're overdosing alone. And so I just want us to look at it through that lens when we're thinking about, who's using drugs and who's overdosing? And it's, people here in our community, could be our neighbors living next door. And so can you help us understand, why are people using illicit drugs? And, a question you've taught me to ask is, what purpose is the addiction serving?
Yeah, well, I want to start first by saying that it's not all about addiction. The vast majority of substance use in our societies is problem-free. So most people that do try drugs, legal and illegal drugs, so alcohol included, cannabis, and the illegal drugs like cocaine, crystal meth, heroin, MDMA, most people don't become addicted. The vast majority. Addiction affects only a small percentage, and why that is, or what's underneath that, is an important question. And there's a number of studies and things that have been done over the year, and we're starting to have a greater understanding of what addiction is and what's underneath it. And for many, many years, our focus has been on the drugs. It's all about the drugs. So drugs are bad, drugs cause addiction. And the latest science is explaining to us that it's not really about the drugs. It's about what is going on in that individual's life, what has happened in that person's life. Trauma is a very is a popular thing that we talk about now in terms of understanding what traumas an individual has experienced. And there was a great study called ACE's Adverse Childhood Experiences Study, which developed a set of questions which, when answered, about childhood experiences, so things that happened to an individual before the age of 18, could actually, the higher they score on that test, it could actually reveal their propensity for addiction in adulthood. And so we're looking at you know, sexual abuse and physical abuse and parental divorce and, you know, these kinds of challenging things that many people face in their childhood without the support of either parents or other loved ones, family, relatives, community leaders coming in and being a part of that resiliency buffer for that individual. And so many people might have adverse childhood experiences, but they also develop very strong resiliency in their childhood, and they are able to rise up and overcome those. Others have difficult traumatic experiences in their childhood and don't develop any resiliency. And when substance use comes into the equation, it can be fun. I mean, people use drugs for all kinds of reasons. People definitely don't use drugs because it makes them feel bad. They clearly use drugs because it makes them feel good. So if people feel better when they use drugs, or for the first time they feel normal, or I remember very clearly the first time that I used an opioid, it was a synthetic opioid called Dilaudid, that I felt normal. I felt, oh, I can, now I'm like myself in my skin. Now I can be the social person I want to be. Now I'm calm. Now I'm relaxed. Now I'm engaged. Now I'm able to interact with people and feel confident. And so those are very powerful feelings for a person. And if they associate that drug with making them feel something that is a way of coping with life and a way of understanding, a way of helping them live in this world, then the drug use is not a surprise to us at all. And the fact that it becomes problematic, I mean, when we talk about addiction, what we mean is a person continues to use a substance or a behavior, because behavioral addictions, I really don't see any differently. They continue to use despite adverse consequences. So the consequences are probably not visible on day one. And I mean, and this is why a lot of our just say no messaging is complete failure in terms of drug policy. You know, just say no, or you just try it one time and you're addicted. Young people in particular are very intelligent and aware that they have friends, and they've also witnessed it in adults using substances, and their lives don't fall apart the next day. They don't overdose the first time. They don't wake up feeling bad the next day. So that messaging, they perceive it to be completely, maybe not entirely accurate. And that's why I think when we talk about substances, we just need to talk honestly about them. Drug use has been with our societies for thousands of years, and it is not going to go away. So the efforts of governments to make drugs inaccessible, make drugs illegal, try and stop drugs at the border, seems rather futile. They have been with us before we had borders. They have been with us before we built border walls, and they will be with us long after. And I mean, as just a classic example, prisons are notorious for drug use within them, and they have tremendous security. So I'm going off track here. I realize that.
One of the things you've said that I really appreciated was one of the things that's actually curbing drug use in young people is they're seeing around them overdose. And that's, you know, been kind of a curb. I love that you talked about resiliency, and that, you know, as we look at root cause, it's not about, you know, we want to minimize trauma as much as possible, but then it's helping our communities to rally around children who have experienced trauma. And, you know, I love that you mentioned family. And, you know, as I was talking to, you know, one of the people I think is a phenomenal leader in the community in terms of, you know, treatment, said that he sees in the community of people who are, you know, looking to overcome addiction, fatherlessness. And he
Mm.
said they don't even care if their fathers are total failures. They just want to have a relationship with their fathers. And he said, like, that's so significant for them in overcoming their addiction and having that community. So I love that you talked about resilience.
Mm.
And then so
Well, in building off of that, I mean, Johan Hari has the quote, "The opposite of addiction is connection." So we're not, and so we've said we just want people to stop using drugs. Drugs are bad, and really, it's not. Drugs are just drugs. You know,
yeah,
drugs are used for good things all the time, really. And so we can't. We need to take the conversation beyond that. And yeah, the opposite of addiction is connection. And most people that are struggling with really difficult substance use disorders are disconnected. They're disconnected, firstly, from themselves, because they don't want to feel the pain and emotion and difficulty and trauma that whatever it is they're trying to cope with and or escape from. Secondly, they're addicted, or they're disconnected from probably from family and close friends. Maybe they've had family and close friends tell them, "We don't like your behavior, and if you don't change your behavior, we don't want to be around you. Like, you can't live here and you can't be a part of our lives until you change your behavior." So that they disconnect them further. Thirdly, they're disconnected from society at large because society treats them like criminals, right? If you're using illegal drugs, for some reason, alcohol, no problem. You can have a major alcohol disorder and, you know, we're not going to treat you like a criminal. But if you have a disorder with other substances, we will treat you like a criminal. So this forces people to hide their behavior, to go into hiding. And that's where there's a major stigma in our societies towards certain substances.
right.
And we need to create more connection points. We need to create more healthy connections. If you are a loved one who has someone in your life that's struggling with an addiction, the role you can play is by being a healthy connection point. And I'm not talking about enabling versus tough love. And, you know, it's not a black and white conversation about that. It's what I'm saying is you create the opportunities to have healthy connections with that individual and on your terms with proper boundaries, but you will think about it, step back from it, try and have other people in your lives who can be objective about it and kind of separate the emotion from it, because I know it's emotionally charged, and find out, am I helping this person connect or am I disconnecting them further? That's the question to ask.
It's so much easier when things are black and white, though. So, okay, I really like your Rat Park experiment, but let's save it to the end if we have time. And let's kind of talk about response. So can you help us understand what is harm reduction, and, you know, why have we been funding it? Why would we want to fund it?
Okay, so I mean, just in a nutshell, harm reduction is anything that reduces harm to society and to individuals. And so we can look at it from both of those perspectives. But from a perspective of reducing harm to the individual, some of the most common ones that we discuss are needle exchanges, things like overdose prevention sites or safe consumption sites, opioid agonist therapy, so that would be medications like Suboxone and methadone, methadose, and drug testing, giving people the opportunity to test their drugs. These are all harm reduction measures, and they are cost effective. I mean, one issue that comes up all the time when we discuss these issues is how much they cost. They actually reduce the cost, the tax burden on society, because they minimize other health complications. Needles is a classic one that is well studied, and it just shows that if we provide people who use substances intravenously with clean needles, they experience less harm. They experience less Hep C. They experience less problems with their bodies. They experience less, like HIV rates dramatically declined when we implemented needle exchange programs in the 90s. So harm reduction is anything that reduces harm. And it's a process. So when we're talking about someone who is struggling with an addiction, the idea that's often floated by people who are in opposition to harm reduction is that we are enabling their drug use. If we're providing them with needles, we are enabling their drug use. And it's crazy to me that people think that they have that much power over an individual that they can influence whether they do or do not use drugs. I mean, people, I know from my own life and when I was using, that safe or unsafe, it really was irrelevant. I was going to use, because that was my comfort, that was my familiarity, that was my ritual, that was my addiction, that was what I was going to do. And so you can make it harder for me, but I'm still going to do it. And so one of the things that harm reduction advocates have recognized and acknowledged is that this is a necessary part of reducing harm to our societies and to the people who use drugs, who may or may not be ready to make changes in their lives. And that's okay. Maybe instead we can use these harm reduction tools as connection points. Again, the connection point. So instead of these people being alienated and ostracized from society and cast away, we're creating services that connect them to people who care for them.
So Daniel, I see how that works, like downtown East Side, right? That's easy for me to imagine. So as a mom, I'm concerned about needles and paraphernalia in my community. But it's different in the Fraser Valley, right? Because we know 72% of people who are dying in private residences. So what does harm reduction look like here? And are we still doing needle exchanges? Because I was under the impression we were just giving out needles. But maybe you can talk a little bit more about what that looks like locally.
Yeah, needle exchange as a term is kind of a misnomer, because it's not like you have to turn a needle in order to get a needle, which is maybe what people interpret that term exchange to mean. No, yeah, they are handed out. And, you have a valid concern about needles and paraphernalia in the community. I think the media overstates that concern. There's plenty, needles aren't as scary as we think they are. I know people fear needle pricks and they fear infections, or they fear fentanyl, but the media has really sensationalized all these things. The media has made fentanyl into a scarier thing than it is. Yes, it causes a lot of deaths, but that is because people are taking an unknown quantity of drugs from an unregulated drug supply. They just have no idea what they're purchasing. As far as needle pricks, and the risk is very, very, very low. And in fact, if you do encounter a needle, on a walk or in the community, you can safely dispose of it. There's nothing that's going to happen to you by picking it up and placing it into an empty water bottle and putting the cap on and returning it to the public health unit. I do think that we need to do a better job of placing needle disposal boxes around the community. The perception, again, is that it encourages or condones drug use. But, we got to move past that. Drug use is going to happen regardless. And a city putting a needle disposal box in is not the city saying, we think drug use is great. It's the city saying...
Yeah. So, okay, I just want to make sure you get to your second point, because you'd said, okay, there's two things. There's reduction to the individual, and then there's reduction to society. Do you want to talk a little bit about that?
Well, that reduction of harm to society is twofold. It's the reduction in cost to the taxpayer. So one study that I'm familiar with involves Housing First, in which the cost benefits of putting a homeless individual into a house is lower cost than it is to leave them on the street, because of the burden on first responders and crime in the community and that sort of thing. So as far as reducing harm to society, the other thing is that it helps to direct individuals that are using substances to services that can actually help them, which is a net benefit for everyone. Now, then, in terms of where these services are located, that always creates conflict, because everyone becomes a little bit of a NIMBY when they want to put a service in your neighborhood, and there's always these discussions about crime increasing in that area. For instance, here in Langley, the Quality Inn by the Home Depot was turned into supportive housing, and then very quickly you're hearing about increases in crime in that vicinity. And so I'm not sitting here like I have all the answers to all the problems and the challenges that our society faces. I do know that I want to reduce it to some of the fundamentals, and that is that we have to have compassion and care for the individuals that are the most marginalized. And we also have to recognize that we are talking about a very small percentage of the individuals in our society that are struggling in that regard. And so, it is our responsibility to help those individuals and to find a way to do it in such a way that helps them, but also doesn't neglect or create harm for the people around them.
Yeah.
Right? So that's complicated. I don't think we can solve that one tonight.
No, I know. I will share, I was very anti harm reduction until I met Daniel, and he's kind of, brought me inside a little bit. But what I do really love seeing is treatment. And I appreciate that if harm reduction is done in the spirit of providing connection, so providing stability for the individual, and then connection points so that they can, choose a more fulfilling life. And, a path of treatment. And so can we talk a little bit about, treatment? And, specifically you shared a little bit earlier that those two camps are siloed. And I think, as nominee running with BC Liberals, this is a place where I think I can make a difference in terms of bridging and, helping to prioritize treatment and ensuring that, effective treatment centers are getting the support that they need.
Yeah.
And being able to collaborate with people in harm reduction. So can you share a little bit about that?
I have something I say is that I needed people in my life who wanted me to stop what I was doing, but I also needed people in my life who wanted to keep me safe while I was doing it. And so treatment is something that I think we need to really consider evidence-based practices. And for a very long time, we have relied a little too much on a moral approach towards addiction and substance use, where our emphasis, our bottom line, has been abstinence. And abstinence is a great goal. It was my goal. It was something that I discovered through the process. Was going to be the only way for me. That was going to be what worked for me. Even though I tried really hard to not have to be abstinent, but I just couldn't do it. Every time I dabbled with anything, it just really got really problematic very, very rapidly. And so we need treatment systems that are evidence-based rather than ideologically based. And I say that because I do have a personal bias against kind of I'm going to get in trouble saying this. I know someone's going to get offended. I have a bit of an issue with the 12-step ideology, just the way it approaches addiction. It cascades it as, you're powerless, the drug is in control of you, you're insane. I mean, that's in one of the 12 steps. We need some higher power to restore us to sanity. Your drug use has made you insane. And I just find there's no evidence to support this approach to recovery and treatment as being highly effective. Cognitive behavioral therapy approaches, programs like Smart Recovery, recognizing the process and allowing treatment centers to implement things like opioid agonist therapy and methadone, which is methadone and Suboxone, is a part of the continuum of care. And the other gap in our system, big gap, is exactly that. The transition from treatment into society, where far too often we've said, I remember the first time I went to treatment, I was very young. I was probably 20 or 21, and I went to a 30-day program. And my perception was after 30 days, I'll be better, right? After one day, I'm sober, I've stopped using drugs. And 30 days later, moved back into society, and I had no supports to help me in that time. So, what people don't need is that messaging of just be sober and you need abstinence. Maybe that is what they need, but what they really need is to discover some meaning and purpose in their lives. And the people that I know who have struggled with difficult substance use problems and overcome, they have all created meaning for themselves. They've all created purpose in their lives. They've all embraced the power of vulnerability, of owning their story, of allowing their past to be an important part of who they are. And You know, meaning is not, it doesn't have to be some ethereal spiritual thing that's about a higher power or something like that. Meaning is something that we as humans inherently have the ability to create for ourselves. And I'm afraid that we live in a society that is meaningless a lot of the time. That people, while substance use among youth is down, anxiety and depression and suicide is up. You know, we are getting our meaning a lot of the times wandering around aimlessly, staring into the phones, and not with any real direction in our lives. And so all that to say, strong evidence-based treatment models are the way to go. Having them available for people when they want them, and having them established in such a way where we are asking them the question, what do you want for your life? I spent too much time in treatment centers that were completely disinterested in what I wanted. They're like, if you knew anything about living, you wouldn't be here. So just shut up and listen to us and we'll tell you how to live your life. I'm like, that's not helpful. This is a valuable person who, despite their difficulty with substances, that doesn't mean they're stupid or lacking value or potential. In fact, some of the smartest people I know have struggled with some of the most difficult substance use disorders. So we need to ask them, you know, what's the pain in your life? What's underneath this addiction? What's going on for you? And what do you want in your life? And create a treatment model around asking people those questions.
Yeah, I am a big advocate for purpose. As you know, it's on my banner.
Right.
Family, economy, and purpose. And, you know, I think our purpose is the lives that we touch and the people that we touch and leaving the world a better place. And, you know, that's the connections that we make. And I think it's, you know, how we interact with our environment. So,
yeah. We need people, we need to be able to help the individuals that do go to treatment centers to transition back into society, job programs, housing opportunities, these kinds of things. And, you know, in Portugal, they've created great incentive for business owners to hire people that were formerly struggling with addictions. There's tax breaks for business owners and that kind of thing. And so there's a lot of governmental solutions that could be done to help transition people from treatment back into society. And if we can break through the stigma part of all this, recognizing that, you know, these are just people. You know, they're not drug addicts. I mean, we reduce people far too often to one-word labels. And if we can recognize these are people who have struggled in our lives, it's so strange to me when I see articles in the paper about young people, youth, you know, under 19 that struggle with substances. The comments on social media are very compassionate. And they question all the time, what happened for that? What was going on in that kid's life? Like, why? It's so sad that this is happening for them and that they ended up like this. That kid is going to become an adult. And when you read the same types of articles about adults, the compassion is gone. We're no longer questioning, you know, what happened. Now we're just labeling and stigmatizing and casting them out of our society because we are so much better than them. And if you'd walked past me on the street during my years in addiction, you wouldn't have looked at me and thought, oh, there goes a drug addict. You would not have had that stereotypical thought because I didn't match your perception of what a drug addict looks like, which is created for us by the media. You know, every time they talk about the overdose crisis, they show us the downtown East End and back alleys and needles on the ground. And we create unconsciously, unintentionally, this perception that that's what addiction is and that's what drug use leads to. And it's just not true. It's not reality. And the people that are at risk of overdose right now are our next door neighbors and friends and sons and daughters.
Yeah, that's a good segue. So I'm going to skip to my last question, and then depending on how many questions come in online, we can come back to Rat Park, and we can also come back to, you know, what you kind of had going for you coming out of treatment finally. So anyway, it's interesting to talk about stigma. So I'd taken my son to hockey at Twin Rinks, and I noticed Fraser Health had some posters in the washroom, and they were like, oh, it's your aunt, it's your sister, you know, and I actually was frustrated by normalizing drug use. But what I've noticed now is they've changed those, like those public service announcements, I guess, for lack of a better term, to overdose is closer than you think.
Right.
which, you know, given the statistics with 72% happening in private residences, they're actually really good ads, you guys. Like they, you know, have an ad of somebody in their bedroom overdosed and someone else in the living room watching TV while it's happening. So, and I think that's probably a more accurate depiction of what's happening.
Yes.
And so, you know, I've been using hashtags don't use. I grew up in the don't do drugs. It worked for me. So I'm still kind of lingering on that. And then delay use. So one of the things, you know, Danielle's taught me is that if somebody delays use until they're 25, they're less likely to become addicted. And then, you know, now don't use alone. And so can you tell us a little bit, just kind of as we wrap here, about your work with the Langley Community Overdose Response? We all play a role. And then also what can we do in our day-to-day lives to be part of the solution?
Right. So the We All Play a Role project that we've been doing for the last couple of years is essentially trying to empower everybody in the community to understand that they do have some role to play in mitigating the overdose crisis. And I think the first thing you can do is understand the crisis. So we've discussed a lot of that tonight. We've discussed fentanyl, we've discussed disconnection, we've discussed the toxic drug supply, and we want everyone that uses substances, whether they struggle with addiction or not, because we do know that the vast majority of people just use recreationally and occasionally, but they are highly at risk of overdose because of the presence of fentanyl in our drug supplies. So understanding and communicating that information to your friends and family, being open about it, just discussing it. Like, you know, drugs don't have to be a taboo topic. They can be as easy to discuss as anything else, because we can acknowledge that they're part of our societies and they will always be with us. So there's understanding it. There's language, there's the way we talk about people. And I kind of already alluded to not reducing people to one-word labels. And we call this people first language. It's thinking about the way you speak about people that struggle with addictions. And do you just call them drug addicts, or will you call them by their name? Will you say, I'm talking about this person and he struggles with addiction? Rather than reducing them, especially the pejoratives like junkie and crackhead and druggie. Those just don't help anyone. They compound shame. People that struggle with addictions already feel a lot of shame. They do their best to hide it and to not let it be known, but we don't need to add to that. So changing our language is a significant role we can play. And while it sounds minimal, it's incredibly powerful. And there's a lot of stories that I've heard about the way people opened up to someone just because of the way they spoke to them and didn't reduce them and didn't demean them and recognized potential within them, and could provide that person perhaps with some hope, even if they didn't have any hope for themselves. Another role you can play, obviously, and we've talked about that, is naloxone. So getting a naloxone kit. And if you don't think you're around substance use or think you'll ever need to use a naloxone kit, I'll just share a story. We trained a lady last year who said exactly that. I don't really think I'll ever need this kit. She was 8 months pregnant. And she said, but I'm willing to do the training and I'll take a kit just in case. And 2 days later, she went to get a checkup for her pregnancy. And as she was walking in, someone shouted out that there was an overdose, and she was able to respond. And obviously had a kit in her possession and was able to save a life. So it's a very significant role you can play. And naloxone is easy to learn to use and completely safe to administer to anybody. You could give it to me right now, or I could give it to a child. It doesn't hurt them. It really does absolutely nothing except reverse an opioid overdose. And so it's kind of a wonder drug, and it's something that you can learn to use. So those are simple things you can do to be part of the solution. Yeah. So role that I'm a part of, just kind of final thing to say about them is that we deliver presentations that provide all this training and information, understanding the crisis, reducing stigma, and training people in naloxone. And we do it all for free to anyone in the community organizations, churches, businesses, nonprofits. If you'd like to train your staff, get in touch and we can arrange something, no cost to you.
Thanks. Okay.
Yeah.
So, you know I kind of said this at the beginning that Daniel and I don't always agree on everything. I've tried to not cut him off too much. But I think, like I said, it's such an important topic and he has such a unique perspective. So some of my takeaways are, that resilience is so important, and, supporting children particularly, and building resilience and coming alongside them in trauma, and providing community for them, and, investing in their families so that their families have, the depth that they need so that they can support children who need help. So, family is super important in this equation. And then I think, hope is such a strong message too. And I mean, Daniel, looking at you, you have 2 jobs, you own a business, you have a wife, 2 kids, you're volunteering in the community, like so much hope there. And then, as I said, I'm such a big advocate for treatment and making sure that there's a direct line from harm reduction to treatment. And I just want to be really clear too. It's drug use is illegal. So I'm not by any stretch of the imagination advocating drug use or recreational drug use or anything like that. I just wanted to make sure that we, had the conversation so that you guys could be aware of, okay, what are some of the mindsets that are happening here that are, contributing to the addiction and overdose. And I think it's interesting that Daniel said, just because you overdosed didn't mean that you had an addiction problem. So I think that's actually another really interesting nuance. So,
yeah.
Okay.
It's worth noting, like on the illegality front there, since you mentioned it, that we really are shifting in our societies in terms of at least not treating people like criminals. And like the police chiefs across Canada have joined in. Our public health officer, like Dr. Bonnie Henry, has said we need to decriminalize all drug use. And I really do think and anticipate that that will be what happens in the near future. Criminalization isolates people. It forces them to hide, so they are higher at risk of overdose, and it separates them from the society that should be supporting them. So we're going to move towards decriminalization, I hope.
Okay, well, I'm going to disagree with you on that. I'd rather see us investing in kids and resiliency and community. But anyway, Daniel and I will continue to debate that offline. I've got a couple questions here. So I've got, what do you think about safe places for people to shoot up that are out there, especially in the downtown east side?
So, I mean, the first thing that I could say about that is that there's never been a fatal overdose at a safe consumption site or overdose prevention site anywhere in the world. So I think that because they create connection points for individuals who use substances, because these individuals are going to be using substances anyway, like there's no way they're going to be like, oh, there's nowhere safe for me to go, I guess I won't use today. That's just not going to happen. So they're using drugs anyway, and we're creating a place where we can make sure they stay alive, plus connect them to resources should they decide to go to treatment, or should they decide to make some changes in their life, or should they decide to get on methadone. And so they might actually meet someone and develop a relationship with a person who cares for them. They might not have anybody who cares for them. So I'm 100% for those spaces because of the positive that comes out of them.
Okay, I have another question here. It's actually more of a comment. And
Okay.
So it is to say their names. And so, this is an interesting comment, actually. 139 illicit drug toxicity deaths in Langley. And I mean, I said these stats myself, with 72% in private residences. And so just being really cognizant that these are people, and particularly in Langley, it's like they're going to have names and stories and families connected to them. So I appreciate the sensitivity there.
That's so true.
Okay, and then I'm not seeing anything else come in through Facebook. I do want to say, since I've disagreed with you, Daniel, another one of the reasons why I decided to put my hat in the ring for this nomination is I'm seeing a lot of polarization in our political culture, and I'm seeing that, people would rather just, go off to their own corner and only talk to people who agree with them. And, I don't think that we're going to get productive solutions that way. No. I think we need to come together as a community, and we need to disagree and debate and, really stand up for what we believe in.
Mm-hmm.
So it's one of the things I appreciate about you, Daniel, like you've been very willing to share your story and your learnings, but you've also been willing to have a conversation with me, even though I might not agree on every single point. We often argue about legalization and decriminalization, but we're still friends. We're still working together on the issue. So, and then I actually see one other, okay, hold on. By supporting those experiencing addiction, we are also supporting their families and loved ones. The impact of addiction and overdose are very far reaching in our communities. I really want to thank Daniel for sharing his perspective so articulately. And it's funny, I just said that wrong. So articulately, and I agree wholeheartedly. Thank you also to Miranda for being open to this important topic and dialogue. And then I have another comment here. I really appreciated the point that although absence is a good goal, sometimes support equals safety while using.
Yeah.
Okay.
Yeah.
Well, we did it.
It's been a pleasure. I really appreciate the fact that we're having this conversation and that you are someone running for political office who cares about these issues. That's not always the case. And so that's very, very meaningful. It's been a challenging 4 years, obviously, with many thousands of lives lost just in British Columbia alone. And it doesn't look like it's getting better. So we need strong individuals who see potential in people and want the best for our societies and for those who are the most marginalized as well. And so, yeah, thanks, Miranda. And I hope that everyone that participated in our conversation has a little more hope tonight.
Mm-hmm. Yeah, thanks for that. So, and then, for those of you who want to learn a little bit more about my campaign, you can check me out at www.mirandawemyss, which is WEMYSS, you can see on the screen.com. And then in terms of the nomination and candidate selection, only people who are members of the BC Liberal Party can actually vote, which means, if you'd like to see me be the candidate, you'd need to join. And so you can do that on my website too, or you can just Google BC Liberal membership and that'll take you to that link as well. So thank you, Daniel. Thank you for sharing, transparently and thoughtfully. And, it's a nuanced issue. And I think that you navigate that quite well. And like most things, there's no silver bullet, but I'd certainly like to live in a province where harm reduction is working hand in hand with treatment, with a continuum of care, so people can live safe, fulfilling, purpose-filled lives. So
brilliant.
Let's close on that.
Thanks, Miranda. Have a great night, everybody.
Thanks, everyone. Bye.